It's a real pleasure to welcome to our Morning Brew couch Marlene Baca. Marlene is a very experienced person with Lovelace Health Plan. She is the Chief Programs Officer, has over 20 years in the healthcare business, and welcome to the show.
Well, thank you.
Thank you for being here today.
Thank you.
Well, we've got a lot of news about healthcare lately now, don't we?
We do.
And I know a lot of your health plan members are wondering, they're confused, they're a little dazed at times. You want to straighten a few things out for us and kind of say what's what and what's not what.
Well, you know, I believe that with all of the buzz on healthcare reform, and the formal name is the Patient Protection Act, that was signed back in March 23rd of 2010. It was an introduction to healthcare reform. With that, it is going to make lots of changes in 2014. But for Medicare beneficiaries, the good news is that they don't have to worry about going onto the exchange. Medicare, Centers for Medicare and Medicaid Services, has left that program as it is. So there were some provisions that took place in 2010 through 2013, but there were really consumer protections for Medicare beneficiaries. So as an example, all preventive services are covered at no charge. It doesn't matter if you're on original Medicare or if you're purchasing a Medicare Advantage plan. So for the Medicare beneficiaries, they don't have to worry about the exchange that was just introduced October 1st.
Well, that's a silver lining, at least.
Yes.
One less thing to worry about.
That is correct.
Now you're hearing from a lot of your Medicare plan members and wondering how this affects them and what they do and so the advice is don't do anything, just sit tight.
Well, I mean, there is an annual enrollment period.
Right.
And that has been going on for many years for Medicare beneficiaries.
So that hasn't changed.
It has not. And when we look at that annual enrollment period, it started on October 15th and it will end on December 7th. So if a Medicare beneficiary is finding at this moment that they are not happy with their current coverage, they can shop, they can compare, they could look at all of their options, and just as long if they enroll by midnight on December 7th, which is a Saturday, they can then make a change for an effective date of January 1st.
Okay.
Who's eligible?
Well, Medicare beneficiaries are usually people over the age of 65, and they've had to at least contribute and work for at least 40 quarters. But I'll use my mother as an example. She was a hard-working housewife, and she got her Medicare through my father, because he was the one that worked and did contribute to Medicare. So usually people over the age of 65, but there are times that when an individual is disabled, they can also qualify for Medicare. It normally takes about 24 months before Medicare steps in. So we do see the elders, but we also see the young disabled that may also qualify for Medicare.
Okay, so it has nothing to do with your income level.
That is correct. So today we're all working and we're contributing to Medicare, and once we become of age, we would then be eligible for Medicare. But keep in mind, when you get Medicare, it's not full coverage.
Right.
So that is why Medicare beneficiaries really have to look at their options. So with original Medicare, there's what's known as deductibles. So you have to pay something out of pocket first before the coverage kicks in. So what people normally do is they look at what is called Medigap plans or Medicare Advantage plans, such as Lovelace Medicare plan.
Right.
Okay.
Yes.
So those give you the extra things that you need to be fully covered.
That is correct. So the deductibles go away, the co-insurance, and co-insurance is usually the 20% out of pocket. And with Medicare Advantage plans, you only pay co-payments for services that you receive. And it really is coverage that's even beyond what Medicare covers. So as an example, with Lovelace Medicare plan, we offer great benefits. We offer dental coverage that original Medicare doesn't cover. We cover some limited transportation, a vision benefit where some of our seniors are able to get glasses at no charge.
Oh, that's great.
We have another program called Silver Sneakers, and I love this program because it is a fitness program where seniors are able to go to the gyms that we contract with.
Oh, wow.
And they're able to work out at no charge.
That's such a
and
great
it keeps them
concept.
healthy. Absolutely.
And it
Look at all
keeps
the
them
cool
involved in the
deals.
community, too.
Yes, and there's also a social aspect to
Yeah.
it.
Sure.
I have this great story. A few years ago, we were at one of the fitness gyms, and we met a couple that actually met at the gym
Oh,
through
how
Silver
cute.
Sneakers, and they got married. So it's always a wonderful story to share.
Oh, that's really sweet.
So if you're coming into that age group, how do you sign up for all this?
Yes.
Now, does the government automatically roll you into Medicare? Does that what happens?
Yes, usually a person will receive their Medicare card. It's their red, white, and blue about 4 months before they become the age of 65, or if they are disabled, they'll get that during that 24-month period. Now, what occurs is that the Part A, which really covers the hospitalization portion, is what we've paid throughout our working career. So that is automatically at no charge. But Part B, which is the outpatient services, that's what individuals would have to pay out of their Social Security check. And that is based, the premium, on the person's income. But the average Part B premium is about $100.
Okay. So are there only certain places that people with Medicare can go to? I mean, like, are there certain hospitals, certain clinics? Do they have to follow under certain guidelines?
Yes.
How does that work?
So when a Medicare beneficiary makes their decision when they first become Medicare eligible or during annual enrollment, it's very important that they do understand the network of providers. So with original Medicare, one of the positives is that they can go to any Medicare provider. With the Medigap, which is traditionally known as A through N plans, it's much more expensive, but they also have the freedom of choice to go to any Medicare provider. With Medicare Advantage plans such as Lovelace, they're dedicating their Medicare to our organization, so that does mean that they have to see the providers that we contract with.
Sure.
Right.
Yeah.
Great.
How big is your network of providers,
Oh
roughly?
my goodness. Throughout the state of New Mexico, we have a little bit over 6,000 providers.
wow.
So it's rather large.
I
Yeah.
would say.
Yes.
I would imagine in this time with healthcare reform in the news and everything else,
Yes.
answers to questions or what people want. How is Lovelace handling that?
Yes, we have representatives that will talk to individuals over the phone, which most Medicare beneficiaries prefer that personal conversation.
Sure.
And they can reach us at 1-800-262-3757. And then, of course, for those savvier Medicare bennies, they can go on the website, which is lovelacemedicareplan.com. Or if they're wanting just to get general information, Medicare.gov is also a great resource. And all they have to do is enter their zip code, and they can see all of the various options that are available in our community.
That's great.
Yes.
Great, great.
Okay, you've taken the stress out of this then.
Yes, yes, for Medicare beneficiaries.
All right, so just to sum up again, the ACA law that's being rolled out now has very little effect on Medicare in terms of changes for Medicare beneficiaries at this point.
That is
it's
correct.
pretty much status quo. The enrollment period is going on right now, and so there's not any reason to get all stressed out about all the other stuff that you're hearing about in the news.
That is correct. Yes, yes.
Okay.
Great.
Now, if you're not in that area, then you can worry about that. We'll have another show on that later when
That sounds good.
sort things out. Okay.
Yes.
Good.
So that, because Lovelace offers individual insurance and what group insurance and company insurance, so
That is
covered in all
correct.
bases.
Yes, yes. And
Okay,
yeah,
Marlene.
we would be more than happy to come back and talk about those options on the exchange.
Yeah,
Okay.
we've
We'll
got
do that.
plenty of time for that because that rollout's going to continue for a few more months.
Yeah.
and
That is
We'll
correct.
just have you back to do that. Again, the key contact points again for Lovelace,
Sure.
very briefly, are what?
The telephone number for a
Yeah.
representative
Yeah.
to assist is 1-800-262-3757 or lovelacemedicareplan.com. And then the federal government website is medicare.gov.
Okay.
Fantastic.
Perfect.